Hello all, this is Dr. Shilpi Reddy, Clinical Director, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. Today we're going to discuss something really important, especially about breast health. You know about the follow-up tests that we do to diagnose breast changes? There are certain number of tests that we really apply whenever you have a breast issue. The first and the foremost is mammography, and in mammography we can predict and diagnose whether the breast tissue is normal, or are there any breast cysts or any breast calcifications, or are there any breast cancer changes. And there are different types of mammography which we really discussed. There is diagnostic mammography, there is digital mammography, there is digital mammography with 3D imprint. So all these really predict the kind of breast lesion and the exact location of the lesion. And the next test that is not having x-ray is the ultrasound also can locate any kind of problems, the depth from the skin, the size and the quality of the problem. That is you can really predict. And it's like a picture that you take called a sonogram and of the breast tissue, and find out if it is a lump or a solid lesion, or is it a cyst, or is it filled with any kind of a fluid or all. And the next test is the MRI, which is done by a powerful magnet and radio waves, and a computer takes a detailed kind of pictures of the breast. And if you have about large breast lumps and lymph nodes, and your clinical breast examination is doubtful, then MRI gives you a perfect picture. There is another test called as ductography, which is also called as a galactography. In this procedure, it takes the picture of the breast ducts, and the doctors can learn more about certain kind of abnormal nipples, especially the nipple discharge, or the masses such as intraductal papillomas, which can be diagnosed with this ductography. They can be like warts or tumors, and they can be benign and they can be malignant also. So pictures of the breast ducts are taken using a contrast, and the contrast material given through the injection to help the breast ducts show up very clearly. And in this we can figure out if there are any dilatations, if there are any growths, or if there are any cysts, or if there is any other problem with the breast ducts. The next test is a biopsy, and the biopsy can be taken directly if the lump is visualized from externally, or through an ultrasound guided procedure if the lump is little inside and you need to correctly enter into the lump and take the biopsy. And the procedure in this procedure we remove a sample of the breast tissue, or it depends on the needle that you use. We use a fine needle at times, we use a trocar or a true cut needle at times. So and the tissue is sent for cytology and examination to figure out what the lesion is actually. In core needle biopsy, we use a wide needle to remove a small tissue, and maybe about the size of a grain of rice, and that is sent for histopathological examination. And you can have a small bruise or swelling or some blood collection in that area, which is quite normal, and it will subside by itself. In fine needle aspiration, we just put in a thin needle to drain the fluid or check and collect the liquid from the center of the swelling, so that we will know what kind of a swelling it is. Usually in sometimes in benign lesions we can be rest assured this is a normal benign lesion, and in some cancerous lesions we get a liquid that when we check there can be cancerous cells also. So fine needle aspiration cytology is an outpatient procedure just like the core needle biopsy, wherein we can get instantaneous results. There are surgical biopsies also, wherein we remove the entire tissue that we are doubtful of, and that is called an excisional biopsy, which we remove and send it for testing. And there's another procedure called as vacuum assisted biopsy. The removal of a small sample of breast tissue is done using a probe that is connected to a vacuum device. A small cut is made in the breast, and with a surgical biopsy needle, uh, we remove this. A small scar is formed, but then nothing much. It can be done as an outpatient procedure, and sometimes we can do a core biopsy with this vacuum as an assistance. And biopsies are always done as an outpatient method under the supervision of ultrasound. You can get a proper biopsy of whatever material, whatever structural lesion that we have. And it is a daycare procedure, and the results are out as soon as possible. These are some of the tests that we really look and do towards diagnosing breast problems and breast lesions. Most of them are outpatient bond tests, and as quickly as possible, we get the results. So it is just about apprehension that people worry about. Otherwise, breast lesions can be diagnosed very easily, and if there is a difficulty, we have assisted procedures to know the exact lesion and how to diagnose the lesion for treatment as soon as possible.